Well, Jim, you have elections too often is your problem in Vermont. Thank you to Governor Douglas, who, as you can tell, he and I have been working on this project together, I guess, for about as long as we've been governor in some fashion or another. And I'm certainly glad to be with him here today. And thank you, Harry, for hosting this event. I certainly want to echo what Jim said about the appreciation for the way in which you are both promoting the application of IT principles to the whole pharmaceutical process, the whole drug prescribing process, and also really just the highlighting through an event like this of the various kinds of successes that have been had, and there have been a bunch of them across the country. I was thinking actually as I walked in here today that this is a real pleasure for me because the last 2 times I was in this building was during the TennCare reform, and both times there were large groups of protesters all through the building at my presence here in the thing. So being here this time with mostly friends, near as I can tell, is a great pleasure for me. This whole subject has had a personal connection with me. When I got out of college in 1967, my first real job was working as a computer programmer in the very early attempts at some form of e-health. I worked for a pharmaceutical company named G.D. Searle, which has since gone on to be merged into other kinds of places, and trying to bring this new technology they call the mini computers that were becoming in healthcare, trying to find ways to bring them to bear on the process of the delivery of health. And I actually, just as I was sitting here thinking, just had a very nice circling around today, in that one of my early installations of my software in 1974, if you can believe it, was in Warsaw, Poland, back a long time before a lot of stuff happened. And on Saturday of this week, I was in Warsaw, Poland, and stopped by the clinic. I can report they are no longer using my software. But it was kind of a nice, after all those years, to kind of come full circle and then know I was coming back up here again within a couple of days to talk about this. In Tennessee, we thought of e-prescribing as a really good place to start with the process of bringing health IT to it. At the end of 2008, we had about 1,600 electronic prescribers, 1,100 or so pharmacies in the state. Just 6 months later, we have upped it substantially, 2,200, 2,300 prescribers. And that's grown dramatically from only 177 of them in 2006. Our number of prescriptions are getting up there, 1.7 million. A contributing factor to this success has been the availability of physician connectivity grants. These are grants that require recipients to e-prescribe for 2 years in order to be reimbursed for costs associated with the purchase of the kinds of systems it takes to do that. The Office of E-Health Initiatives we established to push this effort forward has now done this for about 1,900 providers in 400 sites across Tennessee. Tennessee and Vermont are obviously very different states in many ways besides climate. We have large numbers of providers who are in very rural areas, a long way from broadband access and the such. And one of the ways in which we've really been able to encourage a number of these providers, who are among the ones you want first of all to get into these systems, has been through providing some help, some financial help, and some help in terms of accessing the technology. We also, alongside of that, provided them with e-prescribing training, addressing topics from everything from selecting vendors to how do you adopt it into the daily workflow in a physician's office. We've had about 20 of those sessions across the state with about 350 grant recipients so far. Bottom line is, I think we're helping to get the physician community to move things forward here, and are continuing to plug away at it in a host of ways. One of the reasons that I think this is so important is I really believe in health IT. I really believe that in what is still a very cottage industry in this country, which is the provision of medical care in general, that the need to tie things together with modern information technology is probably as strong, and the opportunities are as great as they are anywhere in our economy. And yet it's so big, it's a sixth of our economy, that you really have to take it a step at a time. The nice thing about eHealth is it's containable. You understand what the transactions are. There's a finite number of transactions, a finite number of products to incorporate in it. And yet it cuts across everything, every kinds of disease, from going in with the flu to the most serious kinds of diseases. Touch in some way on the pharmaceutical system, on the prescribing system. And so I think it's a way to deal with many of the broader issues in IT, whether it be safety and security or adoption by physicians or the technology that it takes to make it work in a much more contained universe. And it's part of the reason that both Jim and I really pushed with this commission the idea of trying to centralize and focus on e-prescribing is a good lever into the entire problem of dealing with this.